when I would have a patient coming in, basketball player or just like a runner who had rolled on, like jumped, was running on grass or something, and there was a stick and wasn't prepared for it and rolled their ankle. The risk of injury rate in that first year after rolling the ankle, it was almost like, depending on the severity of the injury, somewhere between like 30 to like 70% chance of re-injury, right? So if they had a really bad strain, like a really bad sprain, I would say that within the year we'd be doing another protocol because, they thought that they were fine. And then the proprioceptive, like whatever the input coming up to the brain wasn't quite reestablished yet, and then rolled the ankle again. So talk to us a little bit about translation, what that means, and then maybe if we can integrate that into the landing mechanics conversation.
Mm-hmm. A quick aside is I was that guy. I did that in college. I sprained my ankle so badly that I went to NYU Health Services was like, it's one of the worst healthcare facilities on planet Earth. But the guys out there was like, oh, you shouldn't do sports anymore. Like you have sloppy joints. Like you just shouldn't do sports. And I was like, yeah, that's not, I was like 18 or something. It was such a crazy thing to say. Anyway, they at P3 now, they're more than a decade into collecting all of this crazy data on all these athletes, super fine-grained data. And they now see how your feet hit the ground as like how you put your hands up to catch a ball, right? Mm-hmm. Like of course you need active hands, right? Of course you have to get ready for it and you have to kind of like absorb it. And, you're going to have the muscles of your forearm are gearing up for it and everything. And I think that, when I've asked them, there's, these incredible trainers and MDs and biomechanists that they have there, what's going on with these landings? And it ultimately comes down to, in their view, it's sloppy. They're like, it's like you're just throwing your hands at the ball you're trying to catch and the ball bounces off your hand, right? This is an active thing. And it takes not just strong muscles of the lower leg, all of these post-tib and soleus and gastroc, and there are other ones too that you can name. I'm sure I can't, but we don't commonly work those out, and I think in many cases they're weak, which is a problem. But I think more commonly it's just neurological coordination of like all of these things happen in an instant, right? These landing moments are quick, and they're by far the biggest forces in sports, right? Bigger than any amount you push into the bar when you're lifting weights. Like the forces of you landing these are all the biggest forces in sports. And so it's big force, unfamiliar muscles, sloppy landing, and of course that's going to cause a problem. Would you like me to kind of talk about how they do want you to land now? That's probably most useful.
Yeah.
Okay, so
I'm thinking about women who I've said, listen, you need to sprint. It could be a bike sprint, okay, but if you're thinking about sprinting, on a track or on the ground, we do have to be thinking about how you land. And then I also kind of want to think about this in the lens of like hypermobility, right? So if you if you are someone who sprained your ankle and maybe you haven't done the right rehab, what are some ways that you might think of? And I'm not asking you to give prescriptive. It's like you're not a doctor, you're not playing one on TV. Like I'm not asking for prescription, but what are some of the things that we can consider when we're thinking about, okay, how do I actually strengthen these ligaments that have been damaged? And now we have this altered feedback up to the brain, like where the brain can't necessarily accurately sense where the ankle is in space.
Yeah. So I used to sprain my ankles all the time, as I mentioned. And when I started going to like that kinesiologist woman would, she ran essentially a CrossFit type high intensity interval training class with lifting. And once I started regularly lifting, I stopped spraining my ankles entirely. I think I literally think I just built the muscles of my lower leg up. Like, when you're holding a heavy bar, you're stressing those little stabilizer muscles in your lower leg the whole time. What they would recommend at P3 is, everybody goes through this plyometric progression, right? So in the first assessment, there's a dowel on the floor and you are parallel to it with your feet together. And then you hop just like a little bunny back and forth over the dowel sideways, right? As many times as you can in 8 seconds. And that's pretty safe, I think. These are big forces, but I think most people can handle 8 seconds of back and forth and back and forth. And they're going to look at how you land during those 8 seconds. And then now we're going to talk about what plyometric prescription you get next. But basically, everyone who goes in there is jumping in one way or another.
Can I interrupt? Can I stop you for a second? You are jumping laterally. You're jumping left to right, right to left. Okay, so you're utilizing the coronal plane. Okay, go on.
And then, it might be that for the next several months, your plyometric exercise looks a lot like jumping rope or jumping over little tiny hurdles, or they do some pretty cool stuff actually with like jumping where like you're going lateral and then the coach will be like switch, and then you switch which direction you're going, and some really awesome. There's a video of a volleyball player that I'll send you if you want. It's like the way that she moves is like thrilling to me. Where like the coaches are off camera and she's just like, she moves like like usually when you see people move like that, it's like a wild animal, right? She just moves like so naturally and freely, and she's been practicing this for a long time. Anyway, so, but the end of the line, if you keep progressing and they keep seeing that they like your landings, is, plyometric boxes in a row, and like NBA players are just 2 feet together, like little fleas going boing, 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 not even touching the boxes, just clearing over them. And what they're looking for is the neurological firing of the whole system, which is being trained by all of these plyometrics. And this is the big part where they're going to vary from a lot of other labs and trainers. They want you to land with toes up, with a dorsiflexed foot. And what they're looking for here is an active ankle so that the giant force of landing passes efficiently and quickly from the ground into your Achilles and your calf and your quad and your glute, right? So this whole kinetic chain is designed to take the huge force of landing, but they don't want it to be interrupted by some plyometric coaches coach toes down.
Yeah.
Which means when your foot hits the ground, there's a lot of moving parts before it gets to your Achilles and your calf and your quads and your glutes, and it can get awry. Like you're the kind of geek who will appreciate this little fact, which is like, so all of the biggest forces they've ever measured in this gym, which is, again, thousands of athletes, come from people landing toes down on the force plate. And then the next thing that happens in some cases is the heel slaps unbelievably hard, right? This is a bony surface that connects to your knee on the other end. So you have 80% of your weight is in your torso. That's pushing down at the ground, and the ground is immovable. And now you're going to express this force through bone, through your tibia, to your knee. And here's a really disgusting way to think about this, but it takes about 3,000 newtons to fully sever a human spine. And they've measured there's a small woman, she's a friend of mine, she's 5'5", her name's Katie Spieler, she's on the pro volleyball tour. They measured her landing with 3,100 newtons. They measured an NBA player landing with 10
times ground, 10 times forces of what you just said about like the newtons required to sever a spine. Yeah.
No, so she's about at par, and they measured an NBA player with 11,000 newtons. So the point is that like,
you said 3,000. I'm sorry.
Yeah.
3,000. Pardon me.
But the point is, there's plenty of force. This is just stepping off an 18-inch box, right? So if you're dunking in the NBA, it's definitely going to be way more. But they measured an NBA with 11,000 newtons, so triple the force to sever a human spine. So, like, you don't want that force going through your tibia straight to your knee, right? Which could, it might be okay in your knee. Maybe it goes and causes trouble in your lower back, right? But you don't want to pass it up that way. You want to pass it up your body through soft tissue, right? And specifically through the soft tissues that are designed to take huge forces, right? So this would be Achilles, calf. I say quad, which it's not the whole quad, right? This is at the edge of my knowledge, vastus medialis, maybe. And certainly you want to get into the glutes, because if you don't, a third of people don't deploy their glutes in their data, which is a giant cause of lower back pain, is landing from running or whatever without absorbing force into your hips and glutes.
That's so interesting. Toes up. So, I mean, I've always, with plyometrics, I think I actually I have to pay attention now, but I think that my toes are the first point of contact, or is it the balls of my feet? I can't
now it's in your head.
I have to go
right?
back. I'm like, which one am I doing? I don't know. But it's interesting too, because plyos, and I asked this selfishly because both of my children they're competitive. They play competitive soccer. So they're always doing these little drills, right? So they'll do like the back and forth drills, and then they'll put a weight plate, and then they'll jump up on the weight, down on the weight, and then across, up, down. Because, there's a lot of cutting and there's a lot of lateral movement in soccer, as there is in American football and many other sports like basketball, as you were mentioning. But I wonder as well the value, as I think about women who are aging, having that having the Achilles have the ability to have that, to hold that. I don't know exactly the word I'm trying to, the sentence I'm trying to say here, but what I'm trying to say is like this kinesthetic storage, like to have it to be so springy, to have it used to. I mean, if you are, there's a guy out of, I think it's UC, University of California in San Diego, and I think he talks about like when you've had a Achilles rupture, one of the things where he gets into fights with the orthosurgeons where it's like actually an isometric hold is like one of the best things that you can do to retrain the Achilles, right? So it's like just like a 10-second isometric hold and then you release. And of course, there's this whole like the ortho.
Why don't the surgeons want that? Because it's too risky?
Because they think that it's going to be like with the contraction that it's going to remove the sutures or the stapling, whatever they've done to secure it. So the 10-second to 20-second isometric hold just allows for that. Maybe tensegrity is the right word, but I'm trying to think of like what's the layman's word of like, being able to coil and then like being able to absorb the force and then release it. I mean, that's what the Achilles essentially is. So why, for women, why that's important, and this kind of gets into the hip flexor a little bit, is this ability to decelerate, right?
Yeah,
so if you want to, if you're landing, of course, the Achilles is going to take a big chunk of that slowing down of that velocity. But then I kind of want to wrap this into like falling as well. We talk about women are the ones who are falling and breaking hips, and you see the cognitive decline and the death risk that comes from that.